102.9 DRC-FM, Saturday morning on the Big D. It's Jerry Kristafer. Holiday shopping, more holiday hits, by the way, to shop by coming up. Speaking of holiday shopping and all the hubbub as we get closer to the holidays, on the phone here to address depression is Dr. Jeffrey Shelton, psychiatrist at Bristol Hospital's Counseling Center. Dr. Shelton, thanks for being with us this morning.
Thanks for having me.
Is it really true that this time of year in particular, people tend to get more depressed than other times of the year? Is there a holiday depression?
Yeah, absolutely. And unfortunately, there is a higher incidence of depression during the holidays. I think there's lots of things I think that probably contribute to that, but a lot of it I think is that it's a very stressful time for most people, both with their schedules and financially. Research has now shown what we've really known for decades is that stress can cause depression. So I think that's one of the kind of major contributing causes of that increased depression during the holidays.
Now, Dr. Shelton, what's the difference between legitimate, as you would diagnose a case of depression, and just the winter blahs, as we might get, or just to be in a bad mood for a few days? What's the difference between that?
That's a really good question. I think it's not uncommon, this time of year when, the days are shorter and it's more dark and, there is a lot of stress, that everyone can feel kind of overwhelmed and down at times. But it can kind of progress to a point of someone becoming clinically depressed. And, that can be somewhat difficult to define, I think, in terms of the layman. But what I really tell people in terms of, what to look for either in themselves or family and friends is just that kind of loss of vitality. There's a great book called The Noonday Demon written by this fantastic author named Andrew Solomon. And I saw him speak a while ago, and he said, the opposite of depression is not happiness. So the opposite of depression is vitality. So that's the main thing. It's like if you start kind of withdrawing from those activities that you normally really enjoy, or people start noticing that, hey, Joe's not doing the things that he normally does, and what's going on with that, that can really start being a sign of kind of a worsening depression.
Now, if we do think that we have either be it ourselves or someone in our family who shows signs of depression, what's the first step, and then how dangerous can it actually get?
Well, I think the first step, and I think really the most important thing that we do in behavioral health is just to listen to someone, to try to engage with them about what's going on in their lives, to get them talking about how they're feeling, what are they thinking about, and then to get them help. I think that's the main thing, is to get them the treatment that they need if it is getting to that point where it's getting more severe. But depression can be a very, very severe illness. It's recently been recognized as the leading cause of disability worldwide.
Really?
And in terms of, the worst outcome and the thing that we work so hard to avoid is suicide. And so it can progress to that, and suicide is now the 10th leading cause of death in the United States. And unfortunately, here in Bristol, we actually happen to have one of the highest rates of death from suicide of any city in the state. So It's something that, can become a very, very serious, debilitating, even life-threatening illness.
Now, if our listeners have any questions about what you've just shared with us here on the air, can they contact you directly?
Absolutely. They can call me here at the Bristol Hospital Counseling Center. Our number is 860-583-5858.
All right. Thank you very much, Dr. Jeffrey Shelton. Happy holidays to you.
Same to you.
And thanks for sharing this morning.
Thank you.
All right. Take care now.
Bye-bye.